This is Jane from California University, Silicon Valley. This is a great honor to have Dr. Michelle Sun to give us a very good lecture about post-COVID treatments and the prevention. It's all about boosting our immunity. And Dr. Sun will start for her sharing, and then we will have Dr. Yan follow up to have his sharing about traditional Chinese medicine point of view. So we will have both a Western and Eastern medicine point of view to give everyone a broad aspect. Dr. Shan, this is your stage now. Thank you.
Thank you very much. Thanks for your introduction, and thank you for inviting me to join this very meaningful discussion of post-COVID syndromes. I'm going to share my slide. We all know COVID-19, SARS-CoV-2, is a new virus. There's a lot of unknown. Since it's new, just started about over a year ago, and how it affects our bodies is still a lot of mystery. Thinking and talking about mysteries, it reminds me of a famous person. I don't know who can tell me who this person is. And anybody wants to type in or guess or just raise hand? This person is Sherlock Holmes. And I like what he said. Life is infinitely stranger than anything which the mind of man can invent. So Sherlock Holmes is a very famous fictional detective. He solved lots of mysteries in the world. And talking about COVID-19, this mystery, I think we need every one of you to participate. So today, I'm gonna just share a small piece of this puzzle, what I'm understanding about COVID-19 syndrome. Again, my name is Michelle Sun. I've been a primary care physician for about 20 years. And I want to clarify first, and all my community talks are volunteer-based, so it's not related to my work. My intention is to bring most updated medical information to the community for free and bring more people's health awareness. And today, I'm not talking about acute COVID-19 syndromes. People probably already familiar with most of the symptoms. And a relatively new concept and a condition is called post-COVID-19 syndromes. People also call it long COVID. Recently, WHO named it post-acute sequela of SARS-CoV-2 infection, PASC. So they all talking about the same thing. And here I'm going to address 8 most common questions. Hopefully I have enough time. And please stop me if I'm talking too much, because I tend to talk too long. Okay, first is what is a long COVID? And by definition, long COVID currently is 4 weeks after recovery from acute COVID-19 infection. People continue having symptoms. And most importantly, is not explained by alternative diagnosis. So till now, unfortunately, there's about 10% of US populations already got the COVID-19 infection. 50% of people continue report some type of symptoms after 1 month of infection. And 10% of people continue having symptoms 2 months after infection. So this is a very big number. And I want the audience to participate for a question. Like you can make a guess and how many symptoms people have reported of long COVID? Who wants to volunteer? And just make a guess, it's fine. And I can't see the screen, and who wants to make a guess? Sorry, who can help me read the chat?
Okay, the question 1, how many symptoms people have reported of long COVID. Number 1, 5. Number 2, 10. Number 3, 50. Number 4, 100. Number 5, over 200.
Yeah, I saw a couple of people entering the chat. And can you help me read and what's the chat?
Yes.
Yeah.
There will be Dolores said 100. CG says 50. Link 1 says 100.
Yeah, surprisingly, there's over 200 symptoms have been reported of long COVID. COVID-19 is a very devastating virus. It binds to our body's very important receptor called the ACE2 receptor. The ACE2 receptor is presented in many parts of our major organs, including brains, lungs, heart, and GI system, gastrointestinal systems, and kidneys and livers. And even recent biopsy showed in bone marrows of bladders. So as a result of these acute infections, a lot of people continue having multiple symptoms. I listed and highlight the most important or most frequent symptoms. And this include fatigue, shortness of breath, decreased appetite, brain fog, memory changes, anxiety, depression, sleeping problems, even hair loss. So after COVID-19 acute infection, even we cannot detect the virus in the body anymore, but a lot of people continue presented or continue experience multiple organs symptoms and involve lung, heart, brain, kidney, and liver. And so when people presented to my clinic with multiple complaints, I tend to group them into different categories. This helped me better understand their medical symptoms and also help patients better understand their major symptoms and also direct them to the appropriate treatment regimen pathways. So I'm going to go over this briefly with you. And for COVID, long COVID symptoms, I tend to categorize to 5 or 6 different groups. The first is a physical deconditioning. The most common ones is fatigue, weakness, chronic pain, body aches. And the second, very common, is cardiopulmonary symptoms. A lot of people continue having coughing, wheezing, shortness of breath, chest discomfort. The third one is the neurologic symptoms. And people experience, as I mentioned, brain fogs and focal weakness, memory changes, smell changes. And fourth ones, mental health conditions. And think about being isolated, being in the quarantines for a long time. And everybody would develop anxiety symptoms. People feel stressful and having sleeping problems. Significantly, people have PTSD symptoms. And other symptoms also involves in gastrointestinals, such as diarrhea, and abdominal bloatings, pains, and kidney liver function also got infected. And all these symptoms are not standalone. And they are intertwined to each other. And on top of that, social economic status also impact on this disease and outcomes, like with their jobs, their family support, and their friends, and their incomes, and all this impact on the disease consequences. So I'm going to highlight several of the common symptoms and share with you how we address in our clinic. And before I talk about that, and a lot of people ask, is long COVID is a new conditions or similar to other conditions we know? And long COVID definitely is a new condition, but it also shares and overlap to a lot of other conditions we're already familiar with. And I'm going to address like 5 common problems we know. And this helps us to treat long COVID conditions. The first one is post-intensive care syndromes. And we know a lot of people after stay in intensive care unit, they continue to experience physical, mental, and emotional problems. Second is chronic fatigue syndromes. People are probably already familiar with the term. It also called myalgic encephalomyelitis. And this is a condition and is a chronic, very disabled condition. People having profound fatigue, sleeping problems, body aches, last more than 6 months, and post-viral infection. And it's also worsening by exertions. So we just started understanding this condition past a few years. And this definitely helped us to address some of the long COVID symptoms. Fibromyalgia, and people probably heard this word a lot of times. And this is a chronic pain all over the body, accompanied with sleeping problems, fatigue, emotional and mental distress. And I know a lot of people have these conditions and live with this condition. We started understanding better of this condition, and that helped us too. Post-exertional malaise. Initially, I can't even believe these conditions myself. But now we know a lot of people, some people may have a mitochondrial dysfunctions or mitochondria and impairment after viral infection. They presented with very fatigue and tiredness, even after mild or minor physical or mental exertions. The symptoms worsening after 12 to 48 hours after activities. Post-viral syndromes, so people are probably already familiar with. Every winter, I see patients and experienced prolonged cough, wheezings, breathing problems after mild flu or cold symptoms or pneumonias. And people need a prolonged treatment. And so this is not new for COVID. And long COVID symptoms definitely overlapping with a lot of these conditions. Okay, so next I'm going to highlight several common long COVID symptoms, and hopefully, and that will shine some light to cope with your symptoms. First is lung problems. A lot of people having persistent cough, shortness of breath, and wheezings, breathing problems. And so I just I don't want to scare everyone, but I wanted to show people. After COVID, and this can happen after pneumonia, people may have a persistent abnormal chest x-rays and CT scans. And lungs should be the black colors. And when you see the white, which means there's a collapse of lungs or inflammation going on in the lungs. And this persistent up to more than 55% of people 12 weeks after infection. Abnormal lung functions is very common. And cardiac symptoms, because COVID may affect the whole bodies. And some people may get heart failure, myocarditis, which myocarditis is inflammation in the heart and during the acute COVID symptoms. And a lot of people having persistent chest tightness, shortness of breath, leg swellings, and decreased heart functions. The heart function decreasing may persist in 6 weeks or 8 weeks after hospitalizations. And we also can see the MRI changes in the heart and 6 weeks after the infection. So now I ask the audience again. And if you were infected, this is just a kind of a pretend. If you were infected with COVID-19, and what should you do if your shortness of breath or cough has no improvement 2 months after infection, or even slightly worse? And what would you do? And I wanted people type in 1, 2, 3, 4, 5, like go to see a doctor and get further evaluation, cope with it, by supplement to improve energy levels, start exercising, monitor oxygen, heart rate, and blood pressure at home, And who want to volunteer to answer this question?
Okay, I'm seeing the chat here. Some people say number 5. More people says number 1. So there are more people responding now. Basically, it will be either number 1 or number 5. Number
That's
1,
great. And
yeah.
yeah,
Okay.
that's great. That's great. Very, very good answers. So if your symptoms persistent, even 1 month after COVID-19, I definitely recommend you contact with your physicians for further evaluations. And so I just basically want to communicate with every one of you. You need to rule out secondary problems or new disease if your symptoms continues. You definitely need to communicate with your doctor. I diagnosis the pulmonary embolism, which is a blood clot in the lungs. Diagnosis new pneumonias, bacterial pneumonias on top of COVID-19 infections. Diagnosis new heart failures a month or two after the COVID-19 infections. So your doctor might do blood tests, chest x-rays, heart and lung function tests. There are more and more specific guidelines after COVID-19 infection. So if the evaluation is kind of like consistent with long COVID, what we do is first is a pulmonary rehab, and the second is a cardiac rehab, and the third is still rehab. Okay, and what is a pulmonary rehab? And in a simple word, is lung exercise, but it's not just a simple lung exercise, and is guided exercise program. It's guided by physical therapist, respiratory therapist, pulmonologist, and basically monitor your lung functions and give you support and give you nutritional support, give you exercise guidelines to help you do breathing retrainings and also give you psychological support. And you can do it at home because not all insurance cover this rehab, not all the hospitals and provide this service. And if your breathing is reasonable well and your oxygen levels is good, above 94%, you definitely can do this lung exercise at home. And you simply buy this spirometer from online, Amazon. And this muscle training inspiratory muscle trainings is very helpful. There are several studies confirmed it's definitely better than controlled group, better than no exercise group, and improve lung functions. This is not only apply for COVID-19, it also apply for asthma, COPD, emphysema, and after pneumonia, and pulmonary fibrosis, all these chronic conditions. However, if your oxygen saturation decreased, especially below 92 or 94, and you should seek medical attention. Cardiac rehab is the same token, and it's definitely underutilized. And is not applied for after COVID-19 infection, is applied for all the cardiac conditions, chronic heart failure, and post-acute heart attack. And the study already confirmed it's definitely decreased the repeat heart attack by 20%. Unfortunately, only 20% of the eligible patients are participate in this rehab program. Definitely, if you have any chronic heart conditions, you need to communicate with your doctor. And the third one is neurologic symptoms. So first we talk about the pulmonary symptoms, lung symptoms. Second, we talk about heart symptoms. And the third, we talk about neurologic symptoms. And people, unfortunately, may suffering from a stroke or seizures, and or even brain infections as a result of COVID-19 infections. So after infection, acute infection, people may experience memory changes, concentration problems, thinking problems, reasoning problems, and also muscle weaks, numbness, tinglings, and muscle aches. So if somebody had stroke symptoms, seizures, and brain infections, definitely physical therapy is the best treatment 4 weeks after or 8 weeks after. And here I'm going to share with you two common conditions, or relatively unique and also common conditions of a neurologic effect. One is called the POTS syndromes, and the second is a lost smell and taste. And the first one is a lost smell, and it's called anosmia, or loss of taste, agousia. And loss of smell, and may as a result of loss of smell, people may loss of appetite, loss of weight, and potentially may and cannot smell the smoke and gas leaks, and as mentioned, lose weight, and may even cause depressions. Actually, my first patient loss of smell is not from COVID-19. It was several years ago, very severe loss of smells from allergies, rhinitis symptoms. And we did extensive rehab and trainings, and also extensive ENT evaluations. Fortunately, most of these people after COVID-19 infections and symptoms resolved after 1 to 2 months. If not, and olfactory trainings is one of the effective treatment. It's very simple. You can do it at home too. And you buy 4 odors online, and including full floras, and it's a rose smell, citrus, lemon smell, spice, clove, eucalyptus. And you smell each of these smell 15 seconds and 2 to 3 times a day. After 4 to 8 weeks, it can help improve these conditions. 80% of people feel improvement after 2 months. If you want to save money, you don't want to buy this online, you can smell some favorite food you like, including lemons, right? And including some spices like garlic, gingers. And online, you can find at a Mayo Clinic and home guided olfactory trainings, and it is helpful. The second is called postural POTS, is a postural orthostatic tachycardia syndrome. I don't know how many of you heard about this condition. Basically, the symptom is that people standing up and the heart rate jump to over 30 beats, like from 90s can be 120, 130 or higher. And people may experience lightheadedness, palpitations, brain fog, fatigue, inability to tolerate exercise. And often people presented and complains of palpitation. They said, oh, something wrong with my heart. But after examinations, they said, no, your heart is fine. It's your nerve problems. It's an autonomic nerve system. So it's belong to neurologic dysfunctions. And how to treat this condition? This condition is very common. It's common than we thought. People dehydrated, or people tends to be anxious, and people with chronic fatigue syndromes, chronic pain conditions, and some medications also may trigger this autonomic nerve systems. The treatment, I think the most effective treatment is the physical therapy, of course, also including venous compression, which means compression stockings, fluid, and give salt, and monitor their blood pressures. Physical therapy is effective, is not like let you go and run immediately. It's a graded exercise to help you exercise from supine, from lying down position to sitting and then standing, slowly ramping up for 3 months. And the number 4 is mental health sequela. I think people is not unfamiliar this conditions. People feel anxious. People feel depressed about their COVID infections, right? Nobody and everybody would feel the same way, and it affects their sleep. Not only the patient, also the family members got affected too, and people have nightmares, and people cannot fall asleep or stay in sleep. This is up to 40 to 50% of people. And the last one I want to share with you is the physical deconditioning fatigue, weakness, chronic pain. And this is a very devastating conditions and also affect people long-term and cause disabilities. And up to 60% in some studies, and the patient may experience some type of fatigue even 6 months after, even they return to their work. And people complains out of shape, reduce exercise capacities, and even without lung function problems. It could be from a muscle weakness. It could be from, as I mentioned earlier, mitochondrial dysfunction. What is a mitochondria? Mitochondria is our engines in the bodies. Mitochondria is inside of the cells, provide oxygen and ATPs for our bodies. If we don't have the engine, so our engine get impaired, of course we're going to feel weakness. So I think the long-term treatment is focused on build up the muscle mass and improve mitochondrial functions. And another complaint is, of course, related to this deconditioning. They feel like tired, out of breath. It's not only the shortness of breath, they feel like they don't have energy to do anything. And with actually, when you check your vital signs, when you check your heart rate, blood pressure, you often find it's a rapid heartbeat cause your shortness of breath, cause you feel tired, fatigue, and is not just the lung function by itself. So how to treat this condition? So both mental and physical deconditionings, it is very important to understand your conditions, understand your bodies. And so we recommend 4 Ps, and I recommend 5 Ps, planning, pacing, prioritizing, positioning, and physical rehab. I recommend everyone to participate physical exercise, from stretching, strengthening, aerobic exercise. And very few people cannot tolerate if you start slow, go slow. The key things is start slow, go slow. However, if you feel like an exercise make you feel more tired, you take a step back. And so reduce intensities and maybe consult with a physical therapist. That's often helpful. And people ask, yeah, and long COVID, it is very serious conditions. It affects us a lot. Why people have this condition? What caused long COVID? There's a lot of theories behind it, and research is still ongoing. I don't think I have enough time to go through every single one of this. I can share with you some of the outlines, and it's all kind of a mention about our immune response, and one of them is the immune response is too strong. It causes organ damage. And such as like pneumonia, people have pneumonia, people have tuberculosis, they tend to have scars in their lungs, and which can cause lung damage and decrease lung functions. If your immune response is too strong, you can't recognize the foreign bodies and your own bodies. You may generate autoantibodies, and which can cause further damage. And the second theory is a prolonged immune response. Your immune response doesn't have to be very strong, but is chronic, is active. Just like when we see the tigers, our heart rate jump up, right? We run away, our sympathetic nerves goes up and the fight or flight. And this response should go away when the tiger disappears, right? But unfortunately, some of us don't. When we see dogs and cats or some other things, we may kind of triggers the similar symptoms. So as our immune systems. So our immune systems and may continue and being activated. Even the COVID-19 virus disappear. This is very similar to chronic fatigue syndromes, which triggers chronic inflammations, drain our energies. That's why a lot of people feel tired and fatigued. And remaining virus, although this is the third theory, and the remaining virus And a lot of people, 100% of people don't have a kind of a detectable virus, but a recent study showed some remnant of this virus may still exist in a certain part of the bodies and triggers inflammations. And just like, the shingles, right? Shingles is from chickenpox virus. It's just endormed in our bodies, and like TBs, and it may kind of cause problems periodically and depends on your immune systems. And the fourth one is inflammations, and the prolonged activate your immune systems and can cause chronic inflammations. The ACE receptors and presented in almost all the blood vessels and is in the endothelial cells. These chronic endothelial infections can cause a loss of chronic inflammation changes, which can lead to heart, lung, and brain symptoms. And last is virus can lower our immune systems. This lowering immune systems may make us more prone to secondary infections like EB virus, pneumonia. Actually, my first patient after the pandemic was very mimic to COVID, but actually was not a COVID, it's mononucleosis. I asked her did 2 times the COVID-19 test was negative, and finally we did lab work is with mononucleosis. So there's a lot of conditions may and uh, appear after our immune system is getting weaker. So who is at risk for long COVID? And unfortunately, long COVID from the recent study showed may affect anyone who get COVID, including children. Of course, it is more common after hospitalizations, after critical illness, but it may develop in people have a mild, even initially asymptomatic patient. So that's why prevention is very, very important. And it is more common, and as we can imagine, is in elderlies and in women, and women immune response is a little bit different, and also people who had 6 or more symptoms during the first week of COVID-19. And how do we treat long COVID? And I already mentioned about some treatment in my previous kind of talk when I highlight the symptoms. And in general, I want to just to share my thought with all of you. I consider my job like a gardener, and so there's no magic pills and for treating long COVID. Just like taking care of a garden, you need good soil, right? You need a sun, you need air, you need a good fertilizer, you need water, and you need a good seeds. So I often think our basic lifestyles is a soil, and our medications, our interventions is a fertilizer. And without a good soil, and there's no good fertilizers can help the flower to grow and blooming. And so, as I mentioned earlier, and most people presented with multiple organs symptoms. And because of this, and our treatment is multiple approach. First, of course, you want to connect with your primary care physician. And we have a COVID-19 care teams and with the primary care physicians. You want your primary care physician understand your conditions, understand this treatment plans, and direct you to the right specialist. Depends on your symptoms and organ involvement. You might need to see pulmonologist, neurologist, or cardiologist for further testing. Very important, and I want to stay strong in mental health. And physical therapy is very, very important. I have lots of things to share with you about physical therapy. And I mentioned to you earlier about pulmonary rehab, lung rehab, and cardiac rehab, and physical rehab for pulmonary symptoms, cardiac symptoms, and the neurologic symptoms. And also important important to connect with the social workers if you need a social support and you want to communicate with your family members. Let them understand your conditions, get support from them. And so the first, very important, you want to have a very good health insurance, health providers, and a healthcare team. And the second is yourself. And yourself is the soil, right? And we need to plant a very good soil. And so it's a comprehensive self-care. And I cannot emphasize enough about every aspect of these things. One is diet. Often people ask me, what is the best diet? What is the best food? And sorry, if you have any question, you can type it in and I'll address at the end of the talk. And often people ask me, what is the best food? And, you know, it's so personalized and everyone is different. And, but there are some principles and the recent studies support plant-based diet probably is the best diet to fight a lot of chronic conditions. Plant-based diet is not just a vegan diet, a vegetarian diet. You still can eat meat, probably fish and white meat is better, and lots of vegetables. So every week is not only just one single vegetables. And I want every one of you think about what additional vegetables you can eat every day. And so every day is 5 to 10 servings of vegetable. And the second is a physical and mental exercise, which are equally important. The physical exercise, and a lot of people think, you know, they might need intensive exercise to get benefit. Actually, no. And moderate exercise can do the best. So what is a moderate exercise? You get a heart rate up to probably between 140 to around 140 is enough. And when you walk more than 3 miles per hour, faster than 3 miles per hour is good. Mental exercise is good. You want to have a peaceful mind. So that's why more and more people are doing yoga, meditations, and qigong, and all this is going to be very helpful. And sleep. And we all know sleep is important. It helps you generate very good immune response. So there's lots of studies to support that. And I don't think I have enough time address the detail. And hygiene care, like wash your hands, mask, and social distancing, and never forget, especially with the Delta variant. Improve health knowledge and choose a very good health care team and choose supplement wisely. A lot of people ask me, what is the best supplement for immune response? What's the best supplement for anti-aging? And unfortunately, there's no single regimen. And we have to do all of it to make our supplement works. I'm going to share some of them with you. So taking care of treat long COVID. Third is a teamwork. It's definitely a teamwork. And so we want to aware these conditions. We want to build up a strong physical and mental health. We want to improve our lifestyles. We need to get vaccine. We need to get right medications. And also we need to think beyond COVID, like what I mentioned to you earlier. And I have patients with blood clot, new heart failures, some sleep apneas, all diagnoses after they got COVID because they are aware of their bodies more than before. So that's a good news. And they lose weight. So all these are good news. And I think very important is build a good social support and a home support. And So what is the outcome of long COVID? We're still gathering data. And some of the long haulers we know, and I have many patients have a little bit of prolonged symptoms after 4 weeks, but most of them getting better within 3 months. So I think the definition of long COVID might change and in the near future. And so 3 months probably is a better time regimen to monitor those symptoms. And some people, unfortunately, such as people with chronic fatigue symptoms, can continue beyond the 3 months or even 6 months. And COVID-19 probably definitely added up a little bit more chronic fatigue symptoms populations. And to understanding them and to support them is very important. I wanted to share with you on one of my case, and I'm really proud of her. And this is a very 55-year-old African-American lady, and all the patient information is shared is anonymous, and it's just for education. And she's a little bit overweight, and she had a pre-diabetes, asthma, hypertension before she got a COVID, but she got a serious infections. She had a COVID-19 pneumonia and stayed in the ICU for several weeks. That was in January. And 1 week after hospitalizations, she scheduled a video visit with me for follow-up, but she couldn't be able to get on the videos. And I can hear over the phone, and she was a shortness of breath and wheezing over the phone. And as a result of that, I arranged an office visit. She didn't show up the first time, and she showed up 3 weeks after, but she's still with oxygen, in oxygen. She came in with her husband and using oxygen machine. She still cannot speak like a very full sentence. She feel very tired of fatigue. She said she just wanted to sleep every day. She couldn't be able to go back to work. And so she asked me what medicine she can take and what she can do to improve her conditions. Actually, I try to help her lose weight and treat her hypertensions before COVID was not very successful. So I go back to the basic and talk to her about the diet. So we started her on no sugar, very, very low sugar and diet, plant-based diet. And I asked her to set up a routine sleeping schedule and get up the same time, go to bed at the same time, get adequate 8 hours, but not more than 9 hours of sleep. It's very important. If you sleep more than 10 hours, and except when you're having acute illness, and it doesn't help, it's do even worse. So 8 hours sleep. And I set up the home health to help her to start some basic physical therapy. And I also talked to her, even use walker, just walking as much as she can. And she also started on the spirometer exercise. And I told her get enough sun exposure. It's just not walking inside of your room, and get enough sun exposure. Decrease TV and phone use, and no TVs. And at that time, I make sure she's taking the supplement, including vitamin D, B complex, CoQ10, and fish oil. And because of her sleep problems, I also add magnesium threonate, which is a magnesium supplement, may help the sleep. And I didn't give her any sleeping pills. I only give her inhalers, ask her to continue use inhalers. And so I don't know if this regimen worked or not. And surprisingly, she showed up in the clinic 2 months later. She dropped right now she dropped 20 pounds. At that time, it was a little bit over 10 pounds. And she told me just 2 months later, 80% better. Now it's 90% better, more than half. And so her husband came in with her again. They were both very happy. And she used to work in the I think child care industries, and she's getting job retrainings and start a new career. So I'm very happy for her. For people with prolonged fatigue, and in addition to CoQ10, I also often use carnitine supplement. Creatine and carnitine works for help mitochondrial functions. So 10 milligrams daily creatine for 4 weeks, and then decrease to 4 milligrams daily. Carnitine about 1,000 milligram daily. And it might be helpful. It's not a magic pills, but definitely worth to try. And another common conditions, people ask, what if I got a COVID infection? What should I do to prevent hospitalizations? Of course, I don't want any one of you get a COVID, and vaccine is the best prevention. And I can't emphasize more about vaccine is the best prevention. In addition to mask, social distancing, wash your hands, all these good hygienes. So if unfortunately got a COVID infection, like some of the healthcare providers, it's very hard to prevent sometimes. And the first is get pulse oximeter. Just monitor your oxygen at home, monitor your blood pressure, monitor your temperature at home. If your oxygen drops, your blood pressure changes, or your temperature is very high, like a 103, 104, you need to call the advice nurse immediately. Keep active as much as possible, of course, and people feel fatigued, but if you can get up and even make some movement, do some bad exercising, do it. It's very helpful. Get enough sleep. As I mentioned earlier, there's so many studies showed improved sleep help your immune response, and get enough sun exposures. This is very important. 2 times, at least 2 times a day. Get a good nutritious food and fluid. Avoid processed food. Avoid sugars, added sugars. Avoid dessert. And this is not a time to give you a treat. Your treat is vegetables. Your treat is good proteins, good hydrations, if possible. And I often tell people, especially healthy people, and avoid fever medicine if your fever is less than 103. Why is that? Because our body has 2 different types of immune response. One is innate immune response, and the second is adaptive immune response. And the immune response and can help you fight virus immediately. And that's started right after and the virus get into our body, even before developed fever. But we know hydrotherapies just increase your body temperature can help build your innate immune response, and including help secrete more, which is very important. Cytokines is called interferons to fight for this virus. So you don't want to suppress it, you want it to enhance it. So it is important to monitor your temperature, and as long as you don't get confusions, you don't get hallucination, delusions, kind of very severe symptoms, and you can still use the cold compress to your head, and to your bodies, but don't use anti-fever medicine if possible, especially at the beginning, the first few days. And for people, I often do hot and cold shower and alternate, and hot tub, sauna, all this can boost innate immune systems and response. And so before COVID, right now, even after you get COVID, make sure you get vitamin D supplement, get enough zinc, get enough vitamin C. When we treat people with sepsis or including COVID-19 infection in the ICU, we including vitamin C IV injections. So vitamin C is very, very helpful. Zinc is very helpful. And as long as less than 40 milligram daily, vitamin D. And when you get a COVID, you need a 5,000, and not getting COVID, maybe 2,000 is enough. And if you are high risk, call your doctor before you develop any symptoms to get IV monoclonal antibody. Recently, I helped a patient set up monoclonal antibody infusions, and he is a patient with the COPDs on oxygen. So right after he got COVID, and I helped him set up the monoclonal antibody infusion, definitely can help. He's completely recovered. Is another amazing case. And I think this is the end of my presentations. I just wanted to share with you. It's always important to treat a conditions with multi-layers, and it's just not a single bullet. It's and is a teamwork, is a comprehensive self-care. And I hope my talk can bring you awareness. And also I want to introduce you my health education website. It's not mine, it's belong to a group of people, and it's a nonprofit to promote health educations among all Asians and other ethnic groups, and hopefully we can bring updated health information to every one of you. freshlemonhealth.com. Thank you very much.
Let me introduce you, Dr. Philip Young. He's the president of California University Silicon Valley. He's going to having additional information addressing to post-COVID symptoms. Let's welcome Dr. Philip Young.
Hello, everyone. This is Philip Young. Thank you, Dr. Sun, for your information and education to the public. That's a wonderful talk. I believe there will be many people have more questions and want more of your information. Please save your time later so that everyone can ask more questions about the health. Today, I'll share the similar topic, and some of the information is overlapped with Dr. Sun. But the solution will have different point of view. From the research that Dr. Sun just mentioned, right now is in the stage for the data collection. This is one of them from Yale University School of Medicine. From this research, they get the result here. When someone get a COVID, they may damage these systems. Yeah, Dr. Sun just mentioned. In this research from Yale University, the like 1, 2, 3, 4, 5, 7, 12, 13. So the 13 part of the body will be damaged. First, like upper airways. Yeah, that's the first part. That's how we get the mucus and nasal pharynx and trachea, collected epithelial cells, and they get damaged because the virus invaded the system. So we get the corresponding symptoms like the nasal congestion, cold, and runny nose, stuffy nose, or something. And then go to the mouth. Someone had cough, then throat pain, and then go to the lungs. This process, it's very, very interesting. This process really matches the Chinese medicine philosophy, 伤寒论. The first day, we get the symptoms, like I say, get a cold or nasal congestion, feel chills, means the virus has been attacking our body already. Then very quickly, sore throat. At this moment, at this stage, there's no cough. Then 2 or 3 days, start coughing without phlegm. That means the virus go to the lungs already. Then the next will be more cough and with a little bit of phlegm and more phlegms. So there's a cause bronchial valvular leakage and all the symptoms in the lungs. The worst case may be breathing difficulty, COPD, that's in the lungs. Then next will be the heart, cardiovascular system, heart interstitial fibrosis, or vessels endothelial cells damage. Someone get a rapid heartbeat, chest pain, and so on. So usually when someone, recently when someone get the COVID, there's a county guidance, county support team. They said they leave the phone numbers so that you can call them anytime if you have the severe symptoms, especially breathing difficulties. Without these breathing difficulties, just stay at home. Don't go to hospital. After 10 days, right now, the Santa Clara County said it's 10 days quarantine by yourself. And if you have any difficulty, like someone live alone, you don't have anyone to buy grocery for you, you can call the county, the phone number, they can give the support. That's a very, very good service. And otherwise, without these COPD symptoms, don't go to hospital, just stay at home. After 10 days, you are free. Okay, then immune system. If the viruses continue go into the body, they go to the immune system, blood, lymph nodes, and the spleen, they get damaged. And then next, we'll go to the liver, gallbladder, and pancreas here. And of course, in this stage, there will be loss of appetite. Someone may feel the pain in the liver and gallbladder area, and someone may have the constipation or another symptoms, vomiting, throughout, or something. And then next is the gastrointestinal tract. So they may get the stool problems, either constipation or diarrhea, stomach pain, and they cannot digest or hard to digest. And in the GI problems. Then if during this period of time, the virus is not controlled, they will go further to urinary system, cause the urinary problems like a UTI or something. Someone feel the pain when they urinate, and so on. And then for female, they may get a female reproductive tract infection. The same thing, they may feel the pain. They may have the problem with the menstrual cycle, and pain, menstruation, and so on. For male, also may get a testicular spermatogenic infections, and they have the difficulty for urination or frequent urination, something like that. They all get infection in this urinary system or reproductive system. Then next, the nerve damage. The nerve damage is mostly in brain and cerebral system. So they get corresponding symptoms. Like I do have some patients, they do have the tremor. There's one patient have tremor. Actually, his professor, he get a COVID over 6 months. He couldn't recover. He had extremely fatigue, lack of concentration. He couldn't concentrate anything, couldn't type anything, couldn't read for over 2 minutes, just cannot concentrate. And then later I get a tremor. I saw his tremor. When he typed the computer, I always type wrong. He typed A, as A, maybe S or something, I always type wrong. Then take 6 times to make a correct typing. It's very, very difficult. So that's nerve damage. And then someone may get the eye and tears from the dryness of the eyes, aching of the eyes, or conjunctival problems in the eye. And someone will get a mammal glands, and problems in the breastfeeding or something like that in the system. Okay, sorry. Yeah, these are the major damage in the system in COVID. Oh, another one is the skin and adipose tissues, so in the skin problems, like the rashes or something. So that's the overall damage in the major system inside the body by COVID. Depends on how soon it depends on the immunity, how powerful your immunity is. Like someone don't like the vaccine, so they didn't take the vaccine. Someone had the vaccine, but still they get it. Then there depends on how strong your immunity is. That will determine how soon you're going to recover. Like someone, they get the COVID, within 3 days, all the symptoms are gone. They just sleep and take some vitamins, vitamin C or something. Then they get recovered. No any medicine. Someone took some medicine. Someone recovered maybe within a week, 10 days. Then someone have the post symptoms. That means when your immunity is weaker, you do need the external support, like the either some of the medicine or something. So vitamins, dietary supplements, the healthy food, sleeping, all these are very important for your natural recovery. Okay, if these systems or some of the symptoms will get damaged, but still not recover, that become the long COVID syndromes. This is the statistics from Yale University. We can see the percentage of the damage was the biggest portion was digestive system, GI. That's the biggest one. That means the majority of them COVID patients, their digestion will be affected. Then urinary system, 25%. Then reproductive system, 26%, and nervous system, and sensory. Sensory even only 6%, but that's a very slow recovery process. Take a long time. The patient I mentioned, he over 6 months, his sensory gradually came back. And skin disorder, I didn't see too many. You see here also small percent, and also respiratory. This is very, very common. Very common. It's 12%. Okay, and cardiovascular, not so much, 6%, but still, once it happens, that's more severe. And immune system, the symptoms may be not very clear, not very strong, but for sure, each of the patient who get the COVID, their immune system can get weaker or damaged in certain degrees. Gallbladder, pancreas is not so many, but actually, in the point of view of Chinese medicine, for sure, more majority of them get damaged because vomiting throughout, that's a part of the symptoms from the liver and gallbladder. Okay, so that's the research result from 2020 Yale University. The reason I want to share this one, just because we want to know when someone get a COVID, how the virus invade our body, hurt our body, then we're trying to figure out what's the best solutions. Then how to treat the post-COVID syndrome. And the comorbidities, that means like it's very, very hard. It's extremely hard to treat the individual symptoms. Let's say sometimes it's a fever, sometimes it's a heart failure, or sometimes it's the UTI, and many, many different problems. Sometimes many problems, sometimes certain groups of the problems. Then how to treat these symptoms individually? That's very hard. In the point of view of Chinese medicine, we treat the systems, the syndromes. The syndromes here, yeah, Dr. Sun just mentioned, like cough, fever, nasal congestion, COPD, cold, and something. This is respiratory system. And arrhythmia, heart failure, heart attack, the cardiovascular system. Then ageusia, anosmia, and Dr. Sun just mentioned. That's once the loss of smell, once the loss of sensing, tasting, and delirium, that's a kind of a confusion. Brain hemorrhage and embolic events, that's the clottings in the blood. The delimitation and encephalomyelitis. This is the infection in the brain. Lack of concentration, we just mentioned. Fatigue, very, very common, almost to everyone. Then tremor, to even small amount of people, but this is nerve in the nervous system. Usually, when there is a damage in the nerve system, and that means either mostly this is a long COVID and very hard to take a long time to recover. And then the sensory system, dryness of the eyes, blurred vision, foreign body sensation. That means they smell something very, very strange. It's not belong to your body. So that's because of the sensory systems get damaged. And so I do have a patient. She said she always smells something like something burning. Someone smells something, no good smells, all bad smells, very, very strange. And then the UTI we just mentioned, and reproductive systems, and diarrhea, and oral constipation. Okay, that's vomiting, abdominal problems, there's the GI problems. So when we figure out which system it is, we can recall this picture. Then we know in which stage, which system the virus stay on. So by the system we can figure out. And also because they follow the sequences by different timing. They go to deeper to the body. And in Chinese medicine, we categorize 6 stages. 6 stages. Then in each stage, they have different timings. First day, second day, third day, 7 day, 10 days. So go to different system. Go to the liver and gallbladder, that's the deepest. Then we'll have different herbal medicine to dig in the different system, reach the system and fix them. And we don't, let's say you have 6 symptoms. We not exactly we have 6 herbs or 6 meridians to treat the symptoms. No, we figure out, actually, see, if you have group of the symptoms, that's in the respiratory system. Okay, then we have a herb. You have the, we call it exterior. Exterior means the body system, the immunity system is fighting with the virus in the superficial layer, at most to the lungs. If you have the cough or not, will determine means if you go to the lungs or not. Then we'll release the exterior just in this level, like a 桂枝汤. If you have the fever, we use 麻黄汤, something very quickly can release the symptoms. Don't let it go deeper. And if someone has the cardiovascular system problem, the symptoms and like a COPD or something, okay, we do have some herbs that to treat to find the virus, pull it out. There's a herbal formula, it's called Da Yuan Yin. Da Yuan Yin, the herbs can go deep inside. And there's a herb is very interesting, just like a conveying the virus, just go outside, only make you go outside. This is called a Fu Ping. Fu Ping grow on top of water. It's always go to the surface of the water. So same thing, it have the same nature. When it go into the body, always get the virus and bacteria, something going outside. I'm just like a transporter. I'm the car, I'm the truck. All truck ship you outside of the body. So that's a very, very interesting herb. So we use it a lot. And for this one, like even this is nerve damage. You lose the smell, you lose the taste. And that means the virus may still there, or the system become weaker. Then that's on the respiratory system. Okay, they all belong to the system. Then we treat, if you're in the throat, there's a herb like lian qiao. Go to your throat area, lian qiao jie geng, and ma bo and something. Then that will dig out the virus and make you going out. Then this area is not suitable for you to stay. Then you get healed, and so on. We just find different stages of the various locations, and to strengthen the system and to treat the corresponding symptoms. And overall, the strategy for Chinese medicine, we may use different things, different modalities together, like acupuncture, herbs, and exercise and something, everything to combine together to change the environment. That's a little different strategy with Western medicine. Western medicine directly destroy the bacteria, but how to destroy the virus directly. We treated the virus by changing the environment. Usually the body, okay, this is the environment. It's just like a house. If the house lack of sunlight, it's dark, lack of ventilation, it's always closed. It's moisture. Then bacteria, everything is easy to generate inside the house. Then whoever live in the house, of course, easy to get sick. If we assume this is the human body, this kind of human body, this person is always sick. Hi, why are you always sick? Someone get a cold, you get a cold. Someone don't get a cold, you still get a cold. Why? Because your internal environment is suitable for them to stay or to generate yourself. That's not a good environment. The medicine is to change your environment, remodel your house, clean up your house, do this work, start from microbes, use good hygienes. We do cleaning, clean yourself, keep everything clean, and also sweep the floor, get away any dirt and anything moisture, the fermented food or something, and get out of everything, change the environment, make it very, very clean. This clean room with enough sunlight, enough ventilation, everything is clean. This environment is not suitable for either bacteria or the virus to stay. There's no environment. Dr. Sen just said, we needed good soil for our good cells, but we don't need the good soil for the bacterial virus. That's the strategy or Chinese medicine to deal with, to change. That's our task. So what are the bacteria environment inside our body? That's by the philosophers of Chinese medicine. Deficiency, blockage, imbalances, clottings, these are good environment for bacterial virus. What means deficiency? Usually we mention or we mean kidneys or spleen. One's prenatal, one's postnatal. Because prenatal, we get the energy from our parents. That depends on our body constitution. And if you're prenatally, you're weak, postnatal energy can make up, compensate and make it stronger. And also, that's by eating. Also eat well, eat healthily, that can keep our prenatal energy strong and balanced. So if someone has a deficiency by either prenatal or postnatal, then you get a chronic fatigue, obesity. Obesity, here just mention a little bit, someone's very, very overweighted. The overweight, we just touch your muscles, we can tell. So what kind of obesity it is? It is excess or it's a deficiency. Excess, the muscles, the fat is very, very loose, very loose. And if it's excess, it's very solid. Then for the deficiency, especially spleen deficiency, that actually there's a water retention kind of edema, water retention. Then strengthen the spleen, you can lose the weight easily. So this depends. And also edema, like in legs, the water retention in the legs. Now osteoporosis. The osteoporosis, that's by Western medicine is called low calcium level. Yes, it's a low calcium level, but before you get osteoporosis, you have a good level of the calcium. Then where did the calcium come from? From your body. The body can regenerate the calcium enough to support the body, support the health. But for some reason, they are weaker. They cannot reproduce enough calcium. Then you get a lower level. Then which organ reproduce them calcium in Chinese medicine? We mentioned that's from kidneys. So when we treat the osteoporosis, we just strengthen the kidneys. Kidneys, we have two kidneys, kidney yin, kidney yang. We treat one kidney that can treat the osteoporosis. It is not my theory. It's from the classical Chinese medicine. It is correct or not, it depends on the clinical practice. So when I figure out that's from kidney yin, I prescribe the herbs to the patients who ever have the low calcium level osteoporosis for many years, then they can be balanced, can be treated. They get above the average. So that means this theory is true. And also deficiency of the kidneys, including menopause syndrome, low immunity, and so on. All this is a deficiency. So this environment, deficiency environment, is the bacterial or viral environment. Then reverse, to balance them, to strengthen them, is not the environment for the bacteria. Okay. Then blockage is another environment. Blockage of the meridians. How do you know is it blockage or not? Whoever, wherever, whatever you have the muscles tension, pains, let's say neck pain, shoulder pain, lower back soreness, and gastritis, H. pylori, that's all blockage. Just the blockage in different locations, like the GI blockage. In the stomach area, there's no ventilation, there's no sunlight. So then H. pylori generates. And we know, get one session, like 10 days of antibiotics, that can treat it. But after some time, you may regenerate the H. pylori. I'll take it again, of course. But why it keep generating the H. pylori? When someone maybe get healed completely, but someone keep having this. So that means your environment, your body need remodeling. Then we need to change that, just generate the circulation. For the GI problems, chronic GI problems, someone maybe have the patient I treated who have the GI problems since she was 60, but she had a GI problem for 45 years. She got treated by various kind of medications, very kind of Chinese medicines, and different ways from Taiwan to mainland to US, tried everything. It worked, but couldn't completely treat it. Actually, I remodeled her body. She got just within 10 sessions, she got permanently treated. How I remodel the body structure, that's from the back. There's an area. So that's in T10 to T12 area, the thoracic vertebrae, and then generate the meridians. That can treat this problem, and also imbalances. Imbalances of the internal organ in Chinese medicine, it's called a yin-yang balance. What is yin-yang balance? It's very, very hard to understand for the people who learn sciences. Later, let's talk about this. That cause leads to the functional disorders of the organs, that imbalance. And blood clotting, this is very, very easy to understand. Embolic events, stroke, coronary heart disease, deep vein thrombosis, and dysmenorrhea, infertility, headache, stomach pain, and so on. Usually the body clottings in the local clottings cause the pains. And this is a lot of the majority of them is the pains. And then get severe problems like the stroke. So mostly these 4 body constitution, body environment, are the bacterial or viral environment. Then we don't want bacterial or viral or any kind of diseases. Then change them to make diagnosis, to find out which exactly the body constitution is, and change them, remodel them, refresh them, clean them. Then you are healed, you're healthier. See here, what is the balance or imbalances? This is the balance. No matter what, I saw someone in Sausalito. Someone did this on the beach, did a very, very good job. And this is imbalance. Imbalance, I cannot make this one. I don't know how they can make this one. This is very, very high tech to make it still stay here. But it's just like a human body. We still survive, but it's in an imbalanced condition. Then what will be the consequence? Indeficiency will cause the heat, hot flashes, rashes of the skin, hives, and pre-ejaculation, and so on. So long as the indeficiency, the body constitution will be heat, excessive heat. Menopause syndrome is exactly the indeficiency. I said, no, that's a hormone deficiency. Yeah, hormone deficiency is exactly the condition of indeficiency corresponding to the Chinese medicine. That's the same thing, but just different terms. Then yang deficiency. Yang deficiency means yang deficiency generates cold. It's a reverse with the indeficiency. Someone have the cold limbs, always feel cold. Even summer, I feel just okay, but still easy to feel cold. Now it's a fall. How I don't like it. It's cooler. That's a colon because they have a yang deficiency. Yang give the energy to warm up the body, but when they get deficient, they feel cold. And also yang give the dynamic of the body, give the power. It's just like an engine power. Then if it's yang deficiency, diarrhea, loose stool, they cannot digest, cause diarrhea, cause loose stool. Then they cannot give the power to be functional. They cause impotences, cause ED, body constitution, constipation means there's no power to push the stool out of the body. So that's the, if you don't want to accept the yin-yang balances concept, don't want the term, that's fine. The symptoms still happen inside the body. So when we figure out, make the diagnosis and identify which deficiency it is, we treat it, then all these symptoms can be treated. We know the hives is in Western medicine is called autoimmune disorder. Autoimmune disorder in Chinese medicine means combination of deficiency and excessive heat with yin deficiency. Then we balance the yin yang, tonify the yin, and get rid of the excessive heat. Then the hives get treated. You won't get hives again. Of course, you need to maintain this body condition. And here is just examples, the signs of adrenal fatigue, including all these symptoms. This is very, very common, like a fatigue, weakness, suppressed immune system, and increased allergies, muscles and bone loss, muscular weakness, depression, hair loss, cravings for foods high in salt, the salty food, sugar in or fat, craving for this sugar or fat, and the hormonal imbalances, skin problems, and so on and so on. All these signs. This adrenal fatigue means the kidney deficiency. So someone like have hair loss, I don't like it. Hair loss is keep losing. It's scary. It keep going but cannot stop. Yeah, I do some of the patients come here, especially for treating hair loss, but she's 80 years old. I said it should work. It should work, and she came. She came. She's a very, very beautiful lady. She loves beauty, really care about beauty of herself. So I told her, just treat the kidneys. Then you will first get a less hair loss, then stop losing hair, then maybe regrow some hair. Then she came 5 times. She said, oh, it's working, losing less and less. And that all based on the treatment of the kidneys. Okay. So maintain health. It should be healthy, a healthy environment. The Chinese medicine solution, including all these and beyond. First, herbs. Here, like approaches by like the herbs, moxibustion, acupuncture, qigong, positive attitudes, exercise, a healthy diet, and good sleep. So briefly, herbs, I just mentioned, different herbs, different herbal formulas go to different systems to treat different types of the body, change the environment, and treat the corresponding diseases and the symptoms. And balance the organs and generate the circulation and so on. There are more. The examples including Ma Huang Tang is just called ephedra formula. Ephedra, we know, actually 2 weeks ago, I was running, but it's too early in the morning. I wear too short. I get a cold. Then no, I feel cold all over the body. Then in the evening, I get the fever, 98.1. I feel extremely fatigued. Then, unfortunately, I saved some ma huang. I used gui zhi tang and add half a spoon of the ma huang powder. After 10 minutes, I was so exhausted, like lean on the table, on the desk. Then after 10 minutes, I was sweating. Then I get back the energy. Then after sweating, all the fever was gone, just within 20 minutes. Because Ma Huang has the nature that to open your pores, let go the coldness, to release the virus, let them go. You cannot stay here. It just make you going out. So that's the nature of the Ma Huang. And so on all the herbs, different herbs with different nature. It's just like a different people with a different specialty. Then arrange different people to form a wonderful team that can do a teamwork. So all the formulas of the Chinese medicine, that's a teamwork, different teams for different functions. Goji berry, you can buy it from Costco, Whole Foods, very good quality of the goji berries that tonify the kidney in very well. And more. So moxibustion, I believe some of you may know the moxa. What is moxa? Moxa, someone called it the Chinese mugwort, 艾草. Then how the moxa works and why it works. So basically, I summarized the 5 features of the moxa, including clear clottings. Wherever you have the blockage, they just make it go. Don't stuck here. It's just clear the dust on the meridians. And tonifying, you have the deficiency, no matter the prenatal, postnatal, it just make you balanced, make you strong. So tonifying. Circulating, in the wherever, whatever the meridian goes, doesn't matter how much it curves, the moxa energy always follow your meridians and make it circulate. And also penetrating, moxa can penetrate the body, penetrate your clothes. It's not just a heat, but the heat is also strong. Penetrate your skin, penetrate the muscles, go to your organs to find your weakness and fix it. So that's the moxa. There's no any other herb can substitute this moxa. That's why someone don't like the smell, really don't like the smell. They are trying to, someone make the electronic moxa, someone make the charcoals to substitute it. Sorry, no this effect. You have the heat, even have the stronger, it's burning heat, but cannot have the nature. That's why after 5,000 years, we're still using the moxa. Acupuncture and moxa together, they also join together. Unfortunately, right now, a lot of practitioners separate them. Someone just use acupuncture, someone just use moxa. Should join together, makes a ultimate effect. Actually, the name in Chinese medicine, zhenjiu, zhen means acupuncture, jiu means moxa. Zhenjiu, together, so supposed to be together. Acupuncture, the main, someone say, why acupuncture works, how it works. Actually, that's the electric effect. That's why the needles have to be metal. It's just an electric shot because inside the body, the meridian circulation is based on electrical effect. They have the electrodes, positive and negative, positive and negative, so then circulate. Then when there's a metal to stimulate the, just like an electric circus, then make the electric circulate much faster. So that's to unblock the meridians, balance the organs, and so on. That's why acupuncture works. We don't need to give examples because that's so common. And Qigong can do everything. depletion, tonification, balancing, and more, including breathing Qigong, standing Qigong, sitting meditation, visualization, and so on. And you can do the Qigong practice anytime, anywhere. And positive attitudes, everybody know it. You need to be positive. You need to be optimistic. Yes, but for someone, it's so hard. Yesterday, one of the patients, she had indigestion and insomnia. She always like this, never smiles. Her sister was here. Hey, you need to have a smile. Then we have served you together to talk with her. You need a smile. You need a smile. Finally, she opened her mask and smiled. When you smile, the energy circulates. When you this way, energy freeze. Positive energy really make the difference. Positive attitudes, always be positive. In a water bottle, how much water it is? Someone say, it's 2/3 of the water is full. Then someone say, no, 1/3 of the bottle is empty. So that means if you're positive or not, you're negative. Some patients, I ask them, how do you feel? Still have the pain. Then I ask the different ways. Do you feel better? A little bit, but the pain is still there. I said, why you always catch the pains? Please catch up the improvements, even just 1%. Okay, so that really determines the treatment effect. Okay, smile. I need a smile. I need joy. I need positive thinking. Exercise, stamina. That's everybody know the benefit of exercise. Maybe you know better than me. And the healthy diet, Dr. Sun just mentioned many. Dr. Sun is very, very specialized in healthy diet. I hope in the future we can invite Dr. Sun to especially talk about the healthy diet. She's very, very good to summarize many knowledge about a healthy diet. The healthy diet can recharging the body, reproducing the body, the essences of our body to use, like nuts, greens, stearns, and so on. And good sleep. Here we have a little bit of different point of view. What's the notion of a good sleep? Because the good sleeping can naturalizing the organs, energy recharging, and also for the blood reproduction. The best sleeping period, we first care what time you go to sleep. The second care how long you sleep. Like best sleeping period is the 11 p.m. to 3 a.m. We call the golden period of sleep. If you said, no, I go to sleep by 3 o'clock, I sleep 12 hours, sorry, you still have the problems. You may have big problems, excessive heat, congestions, low immunity, aging faster. Nobody like it. I said, oh, no, I sleep long enough. The key is what time you go to sleep. So I strongly suggest to some of the patients reverse their sleeping pattern. Someone go to sleep every day, 3 a.m., 4 a.m., 5 a.m. till 12 noon time. That's why the person is always sick. It's hard to treat them. So I said, without reversing your sleeping pattern, you cannot lose your weight. She's obesity, and also low immunity, migraines, a lot of pains. Okay, so that's the general knowledge I share with everyone. But in the end, I share with everybody kidney foods. The kidney foods, we know there's a prenatal and directly strengthen our immunity and also generate the hormones. These foods is good for kidneys. Seeds. Why seeds? Seeds, nuts, beans, all have same nature because they are the origin of new life. You put the seeds in the soil, then they can generate new plants. So kidneys is the same thing. Kidneys are the seeds of the human body, sperms, eggs, all from kidneys. So new life from here. So that's the natural correspondence. All the seeds, sunflower seeds, apricot seeds, and watermelon seeds, whatever the seeds, just eat them. Okay, that go to the kidneys. Nuts have the same nature. Walnuts, cashews, almonds, hazelnuts, and pistachios, and pili nuts, and so on. All these nuts go to the kidneys, generate hormones, so-called generate kidney essence. All the beans are the origin of the new life too. So black beans, especially black beans. Why black beans? Just like here, dark and black go to the kidneys. In the five organs, all the darknesses go to the kidneys because of the kidney nature. Black sesame and all the beans and also dark foods go to the kidneys. Black sesame, black beans, and black fungus, seaweeds, black rice, and black mushrooms, and so on. Anything black you can find. Black or dark, even like a purple, like eggplants, purple cabbage or something, that all go to kidneys. Fruits, several fruits strengthen the kidneys. Mangoes, jackfruits, durians, figs, guava, all these go to the kidneys, but they generate heat at the same time. But guava will not. Guava will not generate heat, it's depleted heat. So you can eat these fruits and take other fruits to balance the heat. There are a lot of fruits like persimmons to balance the heat and more. And then fish or meat, especially shellfish and the red meat that strengthen the kidneys. But red meat generates too much heat, not suitable to someone who have the heat already. Okay, that's all I want to share. Oh, this is the Qigong. Qigong can do many, many things. In the future, we may talk about the Qigong. Yeah, we do have the ongoing Qigong class to teach all the techniques, how to generate the Qi, how to get the Qi from the nature, from trees, flowers, and mountains, rivers, oceans, and so on. And this is a Maksa that can, we don't want the dark smoke. We let go of the smoke, but we absorb the heat and energy from the bottom. Thank you so much. Thank you for your participating for today's lecture. And I may give you a few minutes. If you have any questions, we can discuss.
Thank you, Dr. Yang, for your presentation. And this is great to understand how to boost our immunity from traditional Chinese medicine point of view. It's very different from the Western medicine, and this is a great addition to our knowledge.
And also, I just wanted to re-emphasize, I totally agree with Dr. Yang and everyone of here. Chinese medicine is a great addition for chronic medical conditions, and it can achieve amazing result. And I totally believe a holistic approach, and especially in chronic conditions. And so I'm glad, and I learned a lot from Dr. Yang today.
Thank you, Dr. Say.
And I see somebody just want to clarify the dosage of the supplement. Yeah, vitamin C in general, I recommend about 1,000 milligram per day. The reason is, I think 2,000 is the upper limit, and especially people with the kidney, liver, or gout conditions, and it may cause some side effect. So in general, 1,000 is very safe. And the zinc is between 30 to 40 milligram, depends on the supplement you purchase. Vitamin D is between 2,000 to 5,000. In general, most of us need at least 1,000 to 2,000 on a daily basis. If you are sick, unfortunately get a COVID or other infections, you might need a little bit higher dosage. Thank you so much for sharing Fresh Lemon Health. Thank you, thank you. It just started, and definitely need your support, contribute, and suggestions. And I want, and volunteer, I want everyone, and if possible, can participate. I think this is meaningful work, and to bring updated information to the public for free. And I'm going to continue update the website and give you more resources in the near future. If you have any suggestions, feel free to email us directly.
I'm here to introduce you our school. This is a nonprofit and accredited higher education institution offering traditional Chinese medicine master program. We're very dedicated to traditional Chinese medicine education and the community contributions such as free lectures and the free clinic.
I have a question for Dr. Sun. I really love the approach you take that's holistic and addressing multifaceted challenges that we were facing. One of the issues that I have right now is, in our current protocol, when somebody have COVID, they get quarantined. In the meantime, I also experience people who get quarantined, and because of lack of support and social interactions, their desire to live dwindles, and they were on the verge of basically thinking their way to their own death. And the interesting thing is when he was surrounded by family, it was like within one day he come back. So that kind of make me think, community build immunity. So I'm really curious to hear from your perspective in terms of caring for people who have COVID, but also observing the protocols so other people don't get infected. What is your take on it?
Very, very good point. And by social isolation itself, definitely create a lot of anxieties. And people feel lonely, fear, lack of support, and depressed. So I definitely agree with your approach. And so that's why we have a care team from hospital-wise and calling patient on a regular basis, usually from the day after and every 3 days. That's a professional doctors or nurses. I think communities, and I wish we can build a similar network. There's a lots of COVID, I forgot to share with you, and social support. And also I hope family members can participate through Zoom and through phone calls and give people support. And they can go outside, exercise. I tell every one of my patients, and still go outside, wear a mask, do some walkings in a quiet place, do yoga, qigong, and listening musics. And I think all these connections definitely help people to fight for the conditions and build immunity. And so that's why I think awareness and make a huge difference. So once people are aware of this problem and also participate and to be volunteer, to be supporters, that make a huge difference.
Okay, Dr. Song. Another question that I have is regarding mitigating the risk factors for developing COVID or getting infected with COVID. And also, if you do, what are some of the things that you're currently doing in addition to education to help people minimizing the risk factors?
Yeah, very, very good question. And I think the first things that we do to minimize risk is vaccination. Nothing is more simple than you go and get a vaccine and your body just build kind of immune system by itself. And it is amazing even with the variants, it's still much more effective. In the hospital, we definitely see majority of patients are non-vaccinated patients. And also it's very interesting. Our observation is definitely elderly and is sicker than younger people. That's because our innate immune systems waning off or and getting weaker with age. That's kind of a hard to change. That's part of the aging process. We try to do everything we can to slow down this progress. That's why, and nothing is more effective than build a healthy lifestyle. It won't change immediately, but definitely you will see the result in the next few months. I believe COVID probably right now is hard to completely and contain, and we have to live with COVID for a long time. Like, hopefully not like a flu, but we live with multiple viruses, not only COVID by itself. So COVID is one of them. It's basically to bring our attention to aware of our lifestyles and our well-beings. So this is a good opportunities for us to recheck or change our lifestyles to a healthy lifestyles and have set up routine schedules. Like Dr. Yang mentioned about the sleeping time, working time, and eating time, and exercise. All this can help build immune system. And so particular for innate system, I mentioned in my talk about interferons. And younger people can quickly generate very high titers of interferon and fight for the disease. That's why, a lot of young people, they don't even know they got COVID, or just within a week, they're fine. So innate systems is responsive within 1 week. And then is adaptive immune response, which generate antibodies from 1 to 3 weeks. In general, we see in the COVID, a very sick patient is lack of innate response and very high over response for adaptive antibody response, which generate high inflammations and overwhelming inflammation response after a week, which cause the organ damage. So this is back to the rebalance of lifestyles. Initially, do not suppress the fevers and hydrotherapy and going to the natures and meditate, yoga, and all this is going to be helpful. There's a lots of studies to see people's stress levels and their kind of a cortisol levels or different inflammation markers. And it's amazing to see how quickly and our inflammation marker can change by relaxations or stress. And when I talk about stress, doesn't mean that everyone stayed at home not working. Adequate stress help build our system, but not chronic, over stressful. So all this, I think, is important in rebuild our immune system. Of course, there's a lot of talk about, different supplement. I think different culture background has their own regimen in healthy food and healthy supplement. But our body is a whole. And so that's why we need a multi-layers of defense. It's not just one. So every single defense has their weaker point. And so that's why holistic approach is often a win. It's not just one silver bullet. And our silver bullet, I think if we have is just slow down the aging and decrease oxidations and minimize stress, improve lifestyle.
Okay, we have Anne in the chat asking, her child is healthy and fit. He hates exercises. Every time she asks him to work out, it's a struggle. What suggestion do Dr. Sun and Dr. Yang have to change the behavior? Thank you so much.
I often ask what's their favorite things and kind of get to know this person. everybody has some their hobbies, right? And what they like. And then you can go from there. And sometimes they say they feel lonely, nobody walk with them. And so we'll ask parents, can you walk together? Or they wanted to do like certain sports and they can't participate. So, I have quite a few patients, especially came from China, and we don't have the habit to get to exercise. And some people just talk to me and say, okay, I can take all the medications, no matter how bitter they are. I can take all the medications, no matter how many pills, but I cannot do exercise. So I asked her, do you walk? And she said, yeah, I walk. How many times of the day you walking? And so she said, oh, walk around the room. So the first step is go outside and walk. Even just to breathe some fresh air, it helpful. And one of the things to change circadian rhythms, and even people not exercise, is go outside the first thing in the morning, right after you get up, and get some sun and face the sun just for 5 minutes. Even you're not doing anything, I think it helpful. And after months, people slowly change. They're kind of just like brush their teeth, right? And who won't not brushing teeth? Everybody brushes their teeth. It's a habit. So once you get them outside, just for 5 minutes, get to a routine. And I think they will like it. They will do it. And it need, I think, family members and invest some time and energies, and especially for kids, and build their hobbies and have work with them together. Dr. Yang, sorry.
Thank you. I may share my experience. I think all the kids, and actually everyone, for their what they are doing, they need to have a goal or motivation. When I was 5 years old, I started to have bone TB of the back pain. Then at 6.5, I got the surgery to clean up all the TB ruined tissues in the back. But I get the post syndrome after the surgery. That's the left side was numb, no any sensation. So the doctor said, there's nothing we can do for that post syndrome except your exercise. So there's no medication, no nothing we can do. Then my dad told me, look at that person who walked this way with the back bending. Actually, he was the used to be a patient who had the bone TB, exactly the same TB. I believe he was 60. I was 7 something. Then my dad said, if you don't do exercise in the future, your walking will be like that person. If you do exercise, you can keep you healthy. At least you are healthy. You don't have to take medications, you don't have to be sick and stay at home every day. I said, okay, I remembered. Then there's no any promotion, no any supervision from my father. I just did myself running every day, starting from 10 years old. Every day, before daybreak, 5 o'clock, and no matter it's snow or it rains, nonstop. After the running, go to the morning classes, and then after that, practice Kung Fu and practice Qigong. So then naturally that become a habit. Till right now, I still keep this habit, running and Kung Fu and Qigong. So I really appreciate my father give me an image, what is good, what is positive, what is negative, which one you choose. So you can tell your son which one you choose. So healthy, unhealthy, weak, paralyzed, or something like the person, or healthy, be a strong person, energetic, motivated, which one you choose. I believe he will make the right choice.
Very, very good point. And I just want to echo Dr. Yang and take small steps. Take a very small reward. And probably the first day is just to go outside and standing outside for a moment. Second day, a few minutes. And also as a parent, you wanted to reward your kids on good behavior. It's not money. It's just, praise, participations, and encouragement. And this is definitely and make a difference. And I think life is a choice, definitely. Health is a choice. I hope through our talk, everyone can make healthier choice for our health.
Thank you.
Okay.
Before we finish, can I share one more thing?
Mm-hmm.
There's in the past 2 years, I've been treating COVID patients, 25 COVID patients, all by herbs. But recently, I received something from, I just get a package from my friend in China. They have an invention. They give me the 100 packages. This is for treating COVID. They said, see, this pack on whoever get a COVID positive, just get 2 patches, but on one is the front, one on the back. Within 4 hours, turn positive to negative. But I don't have the positive patient right now. Whoever, your friend or your surrounding person, whoever get tested positive, please let me know. I can ship this package to them for free. And they just need to give me the result. Say that works.
Thank you again. Thank you, everyone, and enjoy the new week. And I hope everyone is healthier than you yesterday, happier than you yesterday. Okay, bye-bye.